estrogen and go above that 5% ratio that is abnormal. And a lot of you guys are set up for that genetically. 20% of men have an increased conversion genetically from testosterone to estrogen. Those guys struggle with weight gain all their lives. They struggle with erectile dysfunction most of their lives, depression, anxiety, and they just don't function well. And as they get older, it gets worse and worse and worse and worse. But as you get older, let's say you're not one of those genetic converters, as you get older, that ratio shifts and you appear like you're a genetic converter. So we have to always watch for that, because if you don't fix that, you can give them all the testosterone you want in the world, they'll just keep converting it to estrogen and make it worse. So the guys out there, if you've been treated with testosterone and felt terrible afterwards, where you started crying, you didn't feel good, you got breasts, your testicles start to shrink, you get acne, you just feel like terrible, that's because you're converting too much to estrogen. The good news is it can be blocked down. So when you look at testosterone decline in men, here's the other problem, is doctors are notorious for looking at lab reference ranges. References are exactly that, a reference. I kind of call them opinions of the lab manufacturer. They're really a reference. And what's good for me is not going to be good for you. Or what's good for one guy is not going to be good for another guy. The other thing is that you can be in that reference range. That just means you're alive. It doesn't mean it's optimally function. It's like having a C student versus an A plus student. You want to be functioning at that high end and that level where it's good physiologically without going overboard. So when you look at testosterone levels in men, you should be about 1,000 to 1,200 milligrams. But you want to know what? The lab reference ranges go up mainly to 600 or 800. So most of them you have to be above that to be optimum. And the very bottom end of that reference range is 200. If you have a 200 testosterone level, you have the testosterone level of a 95-year-old man. And some doctors will tell them, you're normal, you're in the normal reference range. It's terrible. And there are people walking around who have no idea that they are abnormal because their providers have told them they're within the reference range and they're normal. We have lost the art of listening to patients. You have to listen to what they're telling you, because what might be good for you is not good for you. And if you say, I feel great at a level of 800, and you say, I feel terrible at an 800 level, I'll treat the one that's not feeling great, and I'll leave alone the one that is. You have to look at the patients. We are not lab reference agents. We do not like to be stuffed into a box. So don't question if they're telling you it's in the normal range. We'll say, well, is it in the normal range, or is it optimal for me? That's the question you should be asking. So testosterone deficiency in men, again, these should look very similar to you. Decreased mental sharpness, decreased motivation, weight gain, muscle pain, anxiety, depression, low libido, fatigue, decreased exercise tolerance, irritability. Exactly the same symptoms in women. We both suffer from them. So the other thing we have to look at is testosterone normally declines with age, but there are things we do to you every single day that speed up that decline. Sometimes providers are your worst enemy. Not intentionally. A lot of them don't do it intentionally. They just don't know. But when you look at things that can cause that increased decline, genetics. Some of you are programmed to go through those failures sooner. Medications. Antidepressants are the worst offender. Steroids. Statins. So those meds to treat blood pressure, high cholesterol, they plummet testosterone. Narcotics. So all the painkillers, steroids that we use, anabolics, if you guys, some of them have been juicing up, they will kill testosterone. Infections, being sick, septic, talking about Lyme's disease, things that cause inflammation, and we'll talk more about that later. Steroids are notorious for decreasing testosterone, and cancers. If you've had any chemotherapy, radiation therapy, or any kind of treatment for cancers, you are going to speed up that decline. One thing I forgot to add on this, and I should mention, is that God knows what's in our water system now. You poor guys, there is a ton of birth control pills and estrogen preparations flowing around in that water, and I wonder what it's doing to your testosterone levels. So all this crap in our environment is definitely causing harm. So the one caveat of all this is men and women of any age can have hormone imbalances, and we should not be discounting their suffering. And if you find someone who is, find someone else who listens to you. So the bottom line is, when you talk about these hormones, well, we want to be replacing them. But if they're so great, why is the media trying to scare us from this? Why are other providers pulling us off these medications. And why do people call me every day, other providers, saying, what are you doing to my patient? Why are you putting him on this? I fight this battle every day. Well, this is where it started. History of HRT, well, we found horses, urine was the perfect thing for us. Let's pump these women full of horses estrogen. Well, I don't know about you, but there are some horsey-looking women, but most of us aren't that bad-looking, and we don't need horses' urine. The problem is that then they had all this wonderful information, then they pulled the rug out from under us in 2002. I'll never forget this day. Some of us have those days that we never ever forget, when the WHI launched this article in Newsweek. Hormones are terrible for women, and they're killing us. We're going to die of breast cancer and cardiovascular disease. Get all of your patients off. We got hundreds of phone calls that day. Hundreds. And everybody panicked, and everybody went off their hormones because we're killing you with these hormones. But what was interesting, if you actually go in and look at the data, and I know data makes my head spin, so I'm going to try to keep this simple. There were two arms to that study. One was a study arm that had just estrogen, and one had estrogen and progestins. So the PremPro, for those of you who remember being on PremPro, that's a synthetic estrogen with a synthetic progesterone, medroxyprogesterone acetate. That's what PremPro was. And this is what created this whole hubbub. They said that you had an 8 times risk of developing breast cancer if you were on PremPro. You were going to have 7 times risk of developing coronary heart disease if you were on PremPro. You were going to develop VTE, stands for venous thromboembolism, blood clots. 18 times risk of developing blood clots. You had an 8-time risk of developing stroke. Oh, but by the way, you were going to have a lower risk of fractures and a lower risk of colon cancer. But get off those hormones. You're going to have a heart attack and you're going to have breast cancer. This is what said this. But what was interesting is that when the years went by, and they never announced this arm of the study, the Premarin arm. That was the estrogen alone. The horse's urine, the really bad estrogen. But with that said, that study showed a decrease in breast cancer, a neutral risk for coronary heart disease, increased risk in blood clot and stroke, but oh yeah, by the way, you decrease fractures in colon cancer. Did any of you hear about that? The worst estrogen on the face of the planet by itself decreased breast cancer and heart disease. We never heard about that in the media because it didn't kill anybody. They didn't want to report it. So what was the big difference in those two study arms? It was the progesterone. Medroxyprogesterone acetate neutralizes any positive effect of estrogen in the body, even the bad estrogens. So that was the main problem. But the other thing is, medroxyprogesterone acetate has always been shown to increase breast cancer risk. It is a synthetic, dangerous progesterone. But they never studied the good ones. Prometrium, straight up progesterone that you can have compounded. And they also never studied estradiol, the good estrogen that you can find in compounds and pellets. And by the way, you can actually find it in some pharmaceutical companies. Estrace, 5L-DOT, Clemera patch. Those are all 17-beta estradiol. They're safe. You never want to use medroxyprogesterone acetate. We knew this for decades that it was a terrible drug. But they studied that drug and they scared the crap out of us with those hormones. So the bottom line is you had a government study with horrible media scare tactics, and they said, get off those drugs. It was misleading to you, and it was misleading to us. And what was actually interesting, and I'm not really a conspiracy theorist person, but I do find some intrigue in all this, that actually the statin companies had lobbyists that were working with the NIH. At that time at that decade, year time, 2002, the guy who ran the NIH was a cardiologist who was bought out by the statin guys. They would rather see women on statins than on estrogen. So they tried to scare the heck out of us. So we have to be very skeptical whenever we have studies coming out of the government. So the other thing is, well, why do men not take hormones? Well, first, you guys think you're invincible, which is, you guys are. You're fabulous. We love that. But you guys have this great big fear of prostate cancer. You also think all testosterone are steroids, like you're going to turn into these big muscle guys, and that it's going to be illegal and you're going to go to jail. But the majority of you are just afraid of shots because the bigger you are, the harder you fall, I always say in our office. I'm telling you, it's funny, it's so true. But prostate cancer, do you realize when you actually look at the data that testosterone never caused prostate cancer? It was estrogen excess. And you know what offsets that? Testosterone. Testosterone doesn't cause prostate cancer. It is estrogen excess, so you have to know what you're dealing with. And when I always talk about medicine, we want to look, well, what does cause cancer? Because I get that asked, well, if these don't cause cancer, what do? Well, the bottom line is cancer is an uncontrolled proliferation of cells. In other words, you get a genetic mutation or something that causes that cell to divide rapidly, and it's mutated. It's abnormal. It's kind of like the Green Hulk. The guy, he had something mutated, and all of a sudden he grew. Cancer is that unregulated proliferation of cells. But hormones don't cause that. Genetics either do, or, I'm struggling with this, things that cause genetic damage. So if you look at breast cancer, the BRCA gene, that's a genetic variant that will cause that mutation. Radiation. If you get exposed to radiation in high levels. We actually have guys who have flown in airplanes